Here's a medical thing they don't tell you. Screening guidelines are constantly changing. So in the past, we may have set the age for a colonoscopy to be in the 50s. Now more and more evidence is saying that, hey, younger people are actually getting colon cancer. Maybe we should move the age to something like 45 or 40. And then on top of that, you have people with very strong family histories of colon cancer who might qualify for screening in their teens or in their early 20s. So someone might ask, why not just make the age like 30 years of age so that we're catching the early things, as opposed to just waiting for someone to be in their 40s. The issue with that is that even with screening, you can have things like false positives. Then we would have to call the patient and say, hey, we're worried we found something more serious, and that we'd have to do further surgery, which of course surgery doesn't come without risks, right? All to find out that it was a false alarm and that the patient's okay. But again, we committed them to more procedures. So then the question becomes, what is that equilibrium point? What is that point in which when we screen, we're getting a big enough bang for our buck? This is a costly thing. You can't just do a colonoscopy on everybody that lives in America. It is a costly procedure. So there has to be a balance between when it would make sense to actually do a colonoscopy, when you would find the most cancer for society, just from a cost perspective, but also from an individual patient perspective. You don't want to put people through further testing when they don't really need it.